SBA of the Carolinas is hosting, this is actually our first chapter level webinar that we are hosting as an educational event, and we're really glad to be joined by Dr. John Weiner from Duke University here with us today for this discussion. So I will go ahead and turn it over to you.
Okay, thank you, Christy. I decided, since I'm working from home, to be casual. I'm wearing a walk and roll t-shirt and sitting at my desk. It's an aerial view of Duke University in the background, and there's some cranes there building the new hospital. So I'm a pediatric urologist, which means I trained in urology first, and that involves a lot of sexual medicine, and then did special training in pediatrics. And I treat patients of all ages because Duke doesn't have a freestanding children's hospital. So I see patients before birth up, and my older patients are in their 60s now. So most spina bifida care is centered at children's hospitals that don't see patients over a certain age. And so there were never experts to deal with the adults. The story of spina bifida is really one of the more fascinating and successful stories of 20th century medicine. Before I was born in the 1950s, that the likelihood that a child would live to their second birthday with spina bifida was 10 or 15%. Now it's kind of flipped on its head, and so that we think that up to 90% of newborns with spina bifida will make it to adulthood. And so that's opened up a whole new range of problems, but they're good problems to have. That means that we've done a great job in medicine in getting children to survive to adulthood, but now we have to address adult problems, and that includes sexual medicine. Sexual function is something that's important to all adolescents and adults, and it's been ignored for far too long in the care of people with spina bifida. I've given a lecture in multiple venues on this, whether it's to a bunch of urologists on a very technical level, but I also used to give a lecture at the annual National Spina Bifida meeting to men on male sexual function, and would also sit in the room for the female sexual function. I did not prepare slides. I think that gets kind of boring and stiff, and really just want to make this more question and answer session. So I want you all to kind of drive the content here. I'll give a few opening sections and then really open it up for questions. Because spinal cord, excuse me, spina bifida usually involves the bottom of the spinal cord. That's where the nerves come off, not just to help with function of the bladder and bowels, but also the sexual organs. For females, it's fairly passive in the fact that the ovaries do what they do and make eggs, and they go to the uterus, and they can become inseminated, and a woman can become pregnant without really any input of the nervous system. So most females with spina bifida can be fertile. Males, it's quite different because you need to have nerves to have erections, to have ejaculation. It's unclear how important nerves are just for normal function of the testicles to make the sperm, but for that sperm to get out and shoot out, it's dependent on some nerve function, and so it's quite variable among males with spina bifida. And my colleagues that deal with female sexual function, that's picking up steam, and I think the biggest thing is misinformation. There have been multiple studies that show that individuals with spina bifida either don't get its sexual education, or if they do, it's quite delayed. Most studies show that they want to know more, their parents want them to know more, and we as a medical profession aren't doing a very good job of educating families about this. So that's why we're doing this. And Christy, let me ask you a question.
Just add, sure.
Go ahead.
I was just going to add real quickly, I'm sorry to interrupt, that if you are logged in at a computer, at the bottom of your screen, if you go kind of to the bottom of the picture there should be a Q&A button where you can start to go ahead and type in any questions that you do have. All of our participants are muted and these do come through anonymously. But feel free to just start in with any questions that you have there, and we can kind of keep things going until we have some questions that start coming through.
And Christy, let me clarify, this is supposed to be for parents of people with spina bifida and not necessarily adolescents? Okay.
Right, so the kind of primary target of this was parents of sort of that preteen, teen age who are starting to have some of these kinds of conversations or feel that they should be starting to have some of these conversations with their children and kind of better understand, you know, what types of considerations might be important to talk about or know about. But we very well may have some additional questions that that do come through.
So I think one of the things I've learned from sex educators is that this is not a single conversation. This is not you sit down at a certain age and say, let's talk about the birds and the bees. This is something that you need to talk about in small doses, and as children get older, then they can understand more. But this is a conversation that happens over years, not at one time. And in my clinic, I just, when the children become 10 to 12, I just start talking about it a little bit and say, I'm not going to ask you a bunch of questions. I just want you to know that I'm here. And when you have questions, we can talk about it more. But I see we already have some questions, so let me get started. The first one, can you help with key information, resources that can help talk with a boy going through puberty? Again, I am a surgeon. I'm not a sex educator, so I don't I don't have a long list of resources. So I think that any parenting website will give you some information about general conversations, and I think that's I think to start with, you just need to talk about what puberty is, and you don't need anything special about spina bifida for that. Just to talk about the changes in the body and pubic hair, and for boys, growth of the penis and the testicles, and what the purpose of the testicles are, and about testosterone and how that affects other things such as growth and making your voice deeper and getting a beard. And just talk about puberty in general. And then specific to spina bifida, there's variation in the ability of the penis to feel sensation. So that asking, can you feel when your penis is touched? Because that will be important for sexual function. And then to discuss erections. It's normal for boys at puberty to have a lot of erections, even when they don't want to have them. It's also a normal part of the sleep cycle. During REM sleep, males have erections. That helps the penis grow and keep it nourished with blood supply. And then sometimes there'll be nocturnal emissions or wet dreams. So as you get farther along in that conversation, start asking about penile sensation and erectile, getting erections. So I think those are kind of places to start, just general puberty education, and then talk about or inquire about sensation of the penis and erections. And I think it's always important to say that everyone should have the ability to have children. For some people, it is simple and straightforward. For others, it may require more effort. If ejaculation is not normal, then the semen may not shoot out, and therefore it would be hard to get someone pregnant. In some patients, it goes up into the bladder and then comes out in the urine later. That doesn't hurt anything, but it just makes it hard to get someone pregnant. So some males with spina bifida may need help getting someone pregnant, but doctors can help with that. Some may not have good function of their testicles, and that can be a problem, but that requires a lot of investigation to determine. The next question, for a male with L3-4 lesion, would you expect any sexual function? So some studies have been done, and erections are a lot less frequent in those that are L2 and above. That percentage is, I'm trying to remember the study, I think it was from Italy. It was less than 20% had normal erections, whereas L3 and below, it was much higher, over 50%. It's quite variable, and another problem with spina bifida is that the level of the bony lesion doesn't always correlate with the level of nerve function. But L3, L4 is going to be on that borderline where some patients are going to have trouble with erections, some aren't, some are going to have trouble with ejaculation. And so the question is, would you expect any sexual function? I would expect some, but it will be variable. Next question, is it true that puberty begins earlier in spina bifida children? If so, are there any known tools, books to help me explain things to her, since I don't know what she can or can't relate to? Yes, it's true that puberty begins earlier, I think particularly in girls. It might be due to the effect of hydrocephalus on the brain. That might have some effect on the pituitary gland, but it's definitely true. Certainly there is a shortage of or lack of information specifically for the spina bifida population. We're working on a project to create a series of short videos. We began that process with a meeting about a year ago, but it's a slow process, and we're working on it, but we don't have anything toward that at this time. Again, I think just go to the library or online, and there's good information about talking about puberty, and for girls, what happens about getting pubic hair and breast development, and talking about menstrual cycles, just to get started with. Next question, can you discuss early onset puberty? My daughter is 7 with breast tissue showing pubic hair and underarm hair. Epiphyseal plate testing shows no sign of puberty. Are these tests usually normal in children? What types of treatment may be available? The standard definition, because for the beginning of puberty, has changed some. in the general population, the age is going down. There's lots of theories why that may be occurring, whether it's things in the environment or our diet that are making puberty earlier. Typically, I think the cutoff for what we call early or precocious puberty is age 8 for girls and 9 for boys. But in this sort of situation, 7 does seem a bit early. And I would talk to your pediatrician and probably discuss referral to a pediatric endocrinologist. One of my children had precocious puberty, and there is a treatment of ways to suppress the pituitary gland from sending hormones to the ovaries or testicles to start puberty. So there are treatments for that. The next question. I have a 7-year-old son with spina bifida. Are the early signs of sexual function the same as in a non-spina bifida child? And yes, they should be the same. Again, depending on the degree of nerve dysfunction affecting the innervation of the sexual organs, would just be different. That if they don't get erections, or when they get to the point of having wet dreams or nocturnal emissions, that the semen may not shoot out. Masturbation is a pretty much normal part of adolescence, and as the boys get older, I talk to them about do they masturbate, and some are too embarrassed to answer, and some can, and then we talk about ejaculation, and some can see it come out, and some it shoots out, some it dribbles out, and some don't see any at all. But again, the early signs of sexual function should be the same, and it's very easy to talk about that in a non-threatening manner, talking about the penis growing and the testicles growing and pubic hair developing and beard developing and voice getting deeper. Next question, do any of the bowel therapies, cathing, suppositories, surgical options impact sexual function positively or negatively in the future? In terms of the bowel therapies, not particularly. We do think that constipation can have a negative impact on the nerves for the bowel and the sexual organs. We can see boys who have problems with prolonged erections called priapism when they're very constipated. This is more in the autism and cerebral palsy population than in spina bifida, but constipation can affect sexual function, just like it can affect bladder function. So having a good bowel treatment plan is important. We don't think that putting anything in the rectum, like suppositories or enemas, would cause any problems. And surgery on the bowels typically doesn't involve right around the anus or rectum, so it really shouldn't affect sexual function in the future. Again, the positive impact is that not being constipated makes things work better. As an aside, some of the studies we've done using an international survey of adults, we're beginning to define how often urinary and fecal incontinence occur during sexual activity. And there's very little on this, but we found that up to 50% of patients with spina bifida do experience some incontinence with sexual activity, urinary more than fecal. And as I said, we had a symposium to talk about making these videos that we hope to get out in the future. And in some of the conversations with the adults with spina bifida, they would talk about they sort of need to plan ahead, that if they knew they were going to have a romantic evening on Saturday night, that they might want to do their bowel flush on Friday to be sure that they're all cleaned out. So again, a good bowel management plan is important for good sexual function. And so I think it has positive impact, though not directly on the nerves. As another aside, some of the bladder surgery we do, particularly operating around the bladder neck, can affect nerves to the bladder because you're operating around the prostate, and that's sort of where the nerves are. So there's a potential to affect sexual function with bladder outlet surgery, but not doing things like bladder augmentations or metrophonoms. Next question. Is there a way to test or know if your young adult is fertile or not, so that you know if pregnancy prevention is an issue or not? I would assume that that is about a female. I guess it could be either way. So in terms of females, no way to know for sure. But if they're having menstrual cycles, then assume that they can get pregnant. I just had a patient of mine who's a 20-year-old who learned she was pregnant. And again, this is a big problem because so many children with spina bifida are told they can't get pregnant, and that's incorrect, or they're just not addressed, and they need to have the same amount of teaching to prevent unwanted pregnancies as able-bodied adolescents. For males, obviously they've got to get someone pregnant, there's got to be ejaculation. So if semen comes out, then they possibly can get someone pregnant. And that can be tested to do semen analysis. The laboratory normal values are really start at 18, so we definitely don't test people before 18. But I would always err on the side of thinking that you can get someone pregnant, and also using condoms not only prevents pregnancy, but can prevent sexually transmitted infections. So always important to talk about that. When you have that conversation, then you also need to talk about latex allergies, which are extremely common in spina bifida patients. And I've had patients who learned about their latex allergies from latex condoms. Not a fun way to learn about it. There are non-latex condoms, and they're made out of the same material that we use for gloves in the operating room. When I go to the drugstore and I'm waiting for something, I'll look around at things, and most drugstores carry non-latex condoms. The brand name that's easiest to remember is Skyn, S-K-Y-N. Again, that's important for males and females to not only prevent pregnancy, but prevent sexually transmitted infections. If a woman with spina bifida becomes pregnant, what type of complications might they expect throughout pregnancy and delivery? Great question. So let's talk about somebody who's not had any bladder surgery to start with. Just like able-bodied women, as a baby gets bigger, it's going to push on the bladder, so it's going to create more problems with getting to the bathroom and having accidents. It's harder for delivery for a couple of reasons. One, it may be harder to push depending on the level of the spina bifida. It may be the pelvis sometimes is smaller, and so it may be hard for the baby to get out. The other concern is that even if it's easy for the baby to get out, the pelvic floor muscles do get stretched or damaged in all women when the baby comes out. And because the pelvic floor muscles may not have normal nerve input in patients with spina bifida, most people recommend that women with spina bifida have a C-section. Because if you have repeated damage to your pelvic floor muscles, you're more likely to have urinary and bowel incontinence, as well as organ prolapse, where the uterus falls out. So the C-section really needs to be planned. You don't want it to be an emergency. A VP shunt shouldn't be an issue, but it's always a concern because you are getting into the peritoneal cavity to get to the uterus doing a C-section. It becomes quite complicated if you've had bladder augmentation or a Mitrophanoff, because the bladder sits in front of the uterus and the blood supply to the bowel segment for the Mitrophanoff or bladder augmentation may be draped over the uterus. And so for those patients, I want to be present. So the urologist really should be present for the C-section in that situation. The best studies show that there's maybe a 1 to 5% risk of spina bifida in offspring of parents with spina bifida, and that seems to be whether it's a mother or father. And so to prevent that, if you think that you could get pregnant, then the patient should be taking higher doses of folic acid than general prenatal vitamins, typically 4,000 micrograms, and that's going to be a prescription strength. Without the help of a National Spina Bifida conference, where can my 15-year-old, where could he talk with others, where he can connect with others with spina bifida to help him feel that he is not alone with issues about sexual function? Great question, and I think that's what we're trying to do here. This is the first one of these we've had, and this one is aimed for parents. But Christy, correct me if I'm wrong, but we're the board of the Carolinas Spina Bifida Association is talking about doing this for adolescent boys and adolescent girls. Certainly.
Yep, so that's our hope, is that that would be kind of the next step, and this first webinar style kind of Q&A session would just be the first in a series around this. And certainly we'd love to hear from you all if you think that would be something that would be helpful, a helpful resource for children to attend. We wanted to start kind of with some information more geared toward parents and see how this was received. And so we're glad to see you all here today. And again, just kind of reach out and let us know if that's something else that you would be interested in.
So I think that's something you could work, just encourage the chapter to work on that. But I think you're right, without having in-person meetings, it's hard to get a bunch of males or females of different ages together to talk about it. But again, that's something we can do online, or if there is a Carolinas meeting, I'm happy to be there and kick all the parents out of the room and talk about it. I think there is more going on in Facebook rooms than parents think. I hear a little bit about that, but I try to stay out of that. Next question. My son's urologist usually asks if he's had an erection and leaves any sexual function at that. What more education, and when do you think this should be introduced? Our Spina Bifida chapter is wanting to help provide this information to individuals and families. So erections is a good place to start. Then it needs to go on to, do you reach orgasm? Do you get a sense of pleasure or release when that happens? Does semen come out? How does it come out? Does it shoot out? Does it trickle out? Then I usually examine the testicles to make sure they are growing well. There is some evidence that higher levels of lesions of spina bifida, the testicles don't grow as well, which may be a sign of reduced fertility. But again, this is not something that needs to happen, say, when somebody turns 13. I think it needs to be the maturity level of the patient, the comfort of the parents. Though I usually try to get parents out of the room so that the child is more likely to answer. And some seem very interested in talking about this, and others seem embarrassed. But it just, by continuing to bring it up on a regular basis, they begin to become more comfortable with it and to discuss. So I can't say that there's a right age to introduce it, because I think that even with able-bodied children, the degree of maturity varies among individuals, and I think it's even more so in all children with special needs, whether there are mental issues or that some parents are overprotective, and or at school they're not getting to go to the classes that others go to, which they should be. The next question, my daughter has full spinal rod fusion. Is intercourse safe for her? Her defect is L4 and 5. I'm not an orthopedic surgeon, so I don't know the restrictions that they put on patients. But I would, most likely, I think that intercourse should be safe. Certainly people get injured through kind of crazy sexual activity. But I think with proper precautions, it should not be an issue. Some patients, particularly women, have trouble positioning. They don't have the same strength in their core, or they don't have legs to help balance. And patients tell me that certain kinds of pillows, whether they wedges or roll pillows, help them get in a more comfortable position where they're less likely to fall or get pushed one way or another. So, and I've learned some of that from sex therapists, but there are accommodations with certain kinds of pillows and bolsters that can help put people in a better position depending on how much back curvature they have. Next question. I'd love to know more about precocious puberty, and does it help to intervene or prolonging before they're supposed to have menstruation? Can you chat about what you know about the outcomes of earlier intervention with it? So I'm not a pediatric endocrinologist, and there are, in the last 25 years, there's now a specialty of pediatric gynecology. They may be more knowledgeable about this, but I think for able-bodied children, one problem with precocious puberty is that it's going to cause the growth plates in the bones to close earlier, so they're going to be smaller and shorter. But I think there's a lot of maturity issues as well. Obviously, an 8-year-old having menses can be emotionally difficult. Their brains really aren't mature enough to deal with all that. So I think there's a lot of positive mental benefits from delaying puberty. Unfortunately, I think there are some financial barriers. Some insurance companies cover these medications and some do not. But I think that's again, if you've got concerns, I would see a pediatric endocrinologist, because that's more their area, and I refer my patients to them. I'm a mom. My daughter is only 7, but we want to be prepared when the time comes. I know functionality is important, but feeling and sensation are important for enjoying sex. I'm not sure how much sensation she will have. Any thoughts on how to address this issue? Obviously, it's a little early at 7. I think, again, just talking about the body parts and their names and then what they do as a way to start. Absolutely, feeling and sensation are important for enjoying sex. But sex is more than about penetration. There's a lot of different parts of it. A lot of it is giving pleasure to someone else. And so even if someone has diminished sensation for a female in their vagina or clitoris, there's still ways that they can enjoy. And I think that the important thing is having a partner that understands. So I think teaching your children that they need to develop relationships with people and be open about talking about things. I think most of the adults that were at that symposium I had really emphasized that it's important that sex is not just a physical act. There's a whole lot more to it than that. And that being upfront that these are my problems with having spina bifida. And if someone loves you, they're going to understand that you may not be able to do everything that everyone else can do. You know, if there can be, even if there are urine leakage or something like that, if you have an understanding partner, they will love you and not be turned off. So I think it's important to emphasize that sex is not just a physical act; it's an emotional act. It's the meeting of two people, and it's not just again a physical act. So I think empowering your child to understand that love is a lot more than just having sex, and that how important a relationship is. Next question. Who all follows a female when, if she becomes pregnant? It really depends where you are. For instance, I've had 2 young women get pregnant this spring, and they're usually diagnosed by their local gynecologist. I think it's important for all girls to have a local gynecologist at some point, just to talk about menses, and at some point pap smears are necessary. It can be a little bit difficult because not all obstetricians have tables that are easy for patients with spina bifida to get to. Also want to make sure they have latex-free products. But I think it's important to find a gynecologist that's comfortable seeing a girl with spina bifida. And then if they do become pregnant, then we usually have them referred to our high-risk maternal fetal medicine experts here, and we can discuss whether a urologist needs to be present for delivery. So I think it's working with your local gynecologist and then maybe getting together with a specialist. Now, for milder cases of spina bifida, it can probably be managed by the gynecologist locally. What is your experience with spina bifida in pregnancy? I've been present for several deliveries, and I know several moms who have spina bifida. So it is, my experience is not huge. I don't think anyone has a huge experience with this, as it's a relatively more recent problem as we become more successful in treating individuals with spina bifida and getting them to adulthood. But for the most part, it's been a very positive experience for everyone. Should we talk about childbearing not being an option early on so that you will adjust to the idea over time? I think that's probably, my experience would be that I would not go that way, and that because we don't know who can become pregnant, and if we don't want them to get in their mind that they can't bear children because many women with spina bifida have learned they could become pregnant because they were pregnant. So I think they always need to know that they probably can become pregnant and need to talk about ways to prevent that. And some women with spina bifida absolutely do not want to have children, and others do, but they need to decide that and act appropriately. Is childbearing in women with spina bifida becoming more prevalent. I think it is becoming more prevalent because it's just because we have more adults with spina bifida in America and around the world. So it is becoming more prevalent. The women my age who became pregnant probably had very mild spina bifida and didn't have hydrocephalus. Therefore, that's why they could grow up with spina bifida in the 50s and early 60s. And know some of those women. But yes, I think it's becoming more prevalent. But again, a lot of people with spina bifida don't want that and make appropriate choices. Next question, does variation of sexual function change over time, i.e. low sexual function one day and higher a week later, or once defined will not change in an individual? Interesting question, and these are the kind of things that I love to learn about by talking to adults with spina bifida. Just like every part of living with spina bifida, things can change with changes with nerves, so that patients can develop a tethered cord and have change in sensation or pain in their legs. The same can happen with the genitals, and it can change day to day. One male told me that when he drank caffeine, it helped him have more forceful ejaculation. His form of contraception was none because he didn't think he ejaculated much, and he had some coffee and ejaculated one time and realized that he needed to have a better plan. So it's not completely etched in stone and won't change. Things can change, and there are things that can be done to help with it. There's been some early experience with an operation to help provide sensation to the penis. I'm not doing that operation because I want to see more experience with it to be sure that it has good long-term results. Next question, do you know of any trouble with sexual function, reproduction for a girl with anterior myelomeningocele? To be honest, I don't know. I don't think the data, any data I've read in multiple studies really segregate out standard posterior myelomeningocele versus anterior. So it really would depend more on surgeries they've had and nerve function. But if things should be fairly stable for a while, many years after surgery, and so I think there's should be a good sense of their functioning ability when they're teenagers. Next question, once my daughter starts her period, is she more prone to UTIs with cross-contamination? It's amazing how little this has been studied in able-bodied patients, but just changes in the hormones can change bladder function for women. So a lot of women tell me their continence is different, or their urinary frequency is different when they're pregnant. So the hormones do have some effect on the bladder and urethra. So there's that on a hormonal level. And some people, that could, by changing bladder function, could make you more likely to have a urinary tract infection. So I'm answering that on a hormonal level. On a more physical level, does the blood in the menses make it dirtier down there? I don't think particularly. You know, a lot of patients with spina bifida have some degree of incontinence, and so they're going to stay wetter down there, and there's probably going to be more bacteria. So I don't think the physical appearance of the menses make you more prone to UTI with cross-contamination. I think it's probably more a functional issue with the effect of the changes in hormones on the bladder. You just mentioned early onset puberty is true. My daughter is 9 and breast development and hair has begun. She presents about 2 years behind in her emotional, educational, mentality. Would you recommend contacting a peds endocrinologist simply to allow her mental state to catch up to her physical? Good question. Without it, obviously, it's not an easy answer. As I said, what's considered normal to start puberty has changed, so that now I think for girls 8 is considered within the range of normal, but that's pretty horrifying as a parent. If you do have a developmental pediatrician you work with, that would be best. Let them kind of assess the developmental level, and sort of how that affects so many ways of their functioning, both educational and physical. And then that may help inform a pediatric endocrinologist whether to go forward. But I think to have a good, at our clinic, we have a developmental pediatrician that's sort of the quarterback and helps determine what consults are necessary from there. So I think involving a pediatrician that can give an overall picture and talk to them about whether referral to a pediatric endocrinologist would be best. And I think probably better received by the pediatric endocrinologist, that they get some guidance from a pediatrician about the child. Next one. When a girl with spina bifida has her period start, does it have a tendency to be inconsistent? My daughter is now 11 and her periods seem to start a year ago, but she's only had it for 2 months and hasn't had it since. To my knowledge, this hasn't been studied well from a scientific standpoint. As someone working in a spina bifida clinic for 25 years, I do seem this to be not uncommon. Again, it could be that the hydrocephalus affects the pituitary gland, and so these cycles are not quite as regular. And I know a fair number of girls are on oral contraceptives, not for contraception, but to help better manage their periods. So again, talk to the pediatrician, and then maybe if it continues to be a problem, find a gynecologist that's comfortable with seeing teenagers. Because there are some gynecologists that are more comfortable with this, and I don't think the management of it is any different for someone with spina bifida versus able-bodied girl. Next question, somewhat off topic, but are latex allergies still as frequent with spina bifida, or has this changed at all with hospitals shifting to a latex-free environment? Excellent question. Certainly we not see the allergies manifest the way we used to, because we are latex-free, and it was thought that a lot of the latex allergy was due to all the surgeries early in life, may have created an immune reaction to latex. I don't have scientific answer to that question, but I tend to think that we're seeing less true latex allergy. And is that a question because we are preventing it? Because we try to keep latex away from these patients, or are we not starting the immune reaction? Are we not starting the creating the allergy because they didn't get exposed to latex in the first place? It's probably a combination of the two, but still precautions are a good idea. Next question, I have a 9-year-old girl already growing pubic hair. Will I expect her to begin her menstrual cycle in the next year or so? When is it typical to begin? It's typically, I mean, about a year and a half from developing pubic hair. So I would say, yeah, in the next year I would expect it. But again, it can be a little variable, but usually between 12 and 24 months from starting to get pubic hair is fairly typical. Next question, does a male with spina bifida have smaller penis size? Always an interesting topic because men throughout history and all cultures have concerns about penis size. I tend to think not. The penis size is really determined by the cylinders that fill up with blood to cause erection, and that should sort of be predetermined before you're born. Now, a lot of obesity is more common with men with spina bifida, so the penis appears shorter because there's fat coming up around it. But I don't know of any scientific data that says it's true. And as someone who's examined a lot of males with spina bifida, I don't think that it's true. Again, obesity could make it look smaller. We do know that the testicles may be smaller, and that probably has to do with sperm production. But in terms of the penis itself, I know of no data stating that the spina bifida affects penis size. Do you have any statistics regarding siblings of people with spina bifida having children, and what their risk is for having a child with spina bifida? The thinking is that about 70% of spina bifida is related to folic acid intake, and that's why the American diet has been fortified with folic acid, and doing that has reduced the risk of spina bifida, or the rate of spina bifida, 20 or 30% in the United States. But that also means that at least 30% are not due to folic acid issues. And so there is some genetic component to spina bifida. Certainly, and I've seen my share of patients who with spina bifida who have an aunt or uncle or cousin with spina bifida. So it is increased. I don't know what the exact number is, considering that it's only 1 to 5% in offspring of people with spina bifida. It's going to be even less than that for siblings. But again, they should probably take higher dose of folic acid, beginning at least 3 months before conception. So addressing folic acid levels in the bloodstream in women is important before they get pregnant and in the first trimester. Next question, does spina bifida impact the long-term growth of both the penis and testicles? Again, I don't know anything about that with the penis. I don't think that's an issue. I've certainly noticed that some men with spina bifida do have smaller testicles. Normal size adult testicle is about 25 cc's, and I certainly have some men that have testicles that are 10 or 15 cc's. And there are data showing that the higher the level of the spina bifida, the more likely that is. Most of the bulk of the testicle is the cells that make sperm. So it would translate into probably fertility is reduced in people with smaller testicles. Again, something that we're trying to learn more about. And I think we are learning more about, but no definitive answers there. And again, I think it's going to be, in terms of the testicles, be somewhat level dependent. Are there any sexual educators and sex therapists available at clinics? Are there even any adult spina bifida clinics? So let me tackle the second question first. Are there adult spina bifida clinics? Only in a few cities there are. Again, historically, spina bifida was a disease of children and they didn't live to adulthood. So all the spina bifida clinics were based at children's hospitals. And so in big cities with big children's hospitals like Boston or Philadelphia or Chicago or Atlanta, most of the spina bifida care was provided at those children's hospitals. And when patients got to a certain age, they were basically kicked out. Obviously in smaller cities or in more rural areas, patients got care by whatever doctors there were. There are some cities with adult clinics. We see patients of all age in our clinics and try to, for a while we weren't adding new adults just because we didn't have capacity, but we are. We don't have sex educators and therapists at our clinic. It's just there's not enough time in the day to address the nervous system and the brain and the shunt and the orthopedic issues in the spine and the bowels and the bladder, as well as skin care and educational and occupational things. One of the problems I have is that Medicare and Medicaid don't typically cover sex therapy. And so the sex therapists in our area aren't willing to see patients who have Medicaid or Medicare. So, and for that reason, it's difficult to find sex therapists that have much experience with spina bifida. And it really depends how much they want to educate themselves. Sorry, I couldn't be more positive about that answer. Next question. My 22-year-old daughter has been experimenting with dating sites and has had pornographic replies and requests for pictures, etc. How can I help satisfy her curiosity without being degraded? That's a real important issue. Socialization for people with spina bifida can be difficult, and therefore they can be more prone to being preyed upon. It's particularly important for females. So they need to learn, be taught at an early age about their privacy and what is an okay touch and what is not an okay touch. It's more problematic for people that are catheterized by people outside their family or even people within their family, so that they're being touched down there by others, and they need to learn how to develop boundaries. There are people out there who have fetishes about having sex with disabled people, and so it really has to be a conversation about standing up for yourself and realizing that there are people that want to take advantage of people with disabilities. I think she probably needs to, again, figure out ways to network with other people, with other adults with spina bifida, to talk about their experiences and how they deal with this. So I think curiosity is good, but I think being self-confident and knowing how to draw boundaries is even more important. I'll take that to say that I think that talking to adults with spina bifida, having self-confidence is such an important thing. Adolescents wonder, how do I become sexual? How to become attracted to someone? And it's a lot more than being physical. Being an interesting person and having hobbies and interests make people attractive to other people. And so for someone to have a good sexual experiences as adults, they need to be interesting people with self-confidence. And I think that stuff begins when you're 6 or 7 or even younger than that, about being able to have some freedom to develop hobbies and it may not be what the parents exactly want to do, but let the person develop their own personality and and own interest to become an attractive person to others as an adult. Christy, I guess we're at 1 o'clock. I'm happy to keep going. I know there are more questions. And I'll take your
Sure.
guidance.
So yeah, we are at about our hour. So I think at this point, if you're willing to take a few extra minutes, we can take any questions that are in the lineup right now, cutting off whenever you need to. And if there is anything that we are unable to get to, we can certainly try to provide some additional follow-up resources outside of the context of this recording. So.
Okay.
I think looks like there's 5 more that came through. So if you're willing to, then I'm happy to do it.
Right. Okay. My daughter is 7 years old, but is a head shorter than her classmates. Is this normal, or will she catch up during puberty? There could be several issues. It depends on the amount of scoliosis. Obviously, if your spine is not as straight, you're going to be shorter. If your legs aren't as straight, then you're going to be shorter. But I think that some patients with spina bifida just are shorter anyway. And we know this due to differential growth. Some have very short torsos. Some have short legs. So I think it can be variable. Precocious puberty is going to make one shorter because the longer before you go through puberty, the longer your growth plates and your bones stay open. And so precocious puberty will end up with someone being shorter. But this would be a good question for their orthopedist, looking at their spine and their legs. I've spoken to many moms that had a miscarriage right before they became pregnant again with their spina bifida child. Is there any known correlation? I'm not aware of any. It would seem to make sense. Say there was folic acid deficiency. Either the first pregnancy could have used up more folic acid stores, or they were folic acid deficient to start with, and it could have been that the first miscarriage was also spina bifida and was more severe, and other neural tube defects that are not compatible with life, like abnormal brain development. So I could biologically explain why the correlation between folic acid and neural tube defects, of which spina bifida is one. So it would not surprise me, but I'm not totally informed about that. With possible erectile dysfunction for spina bifida males, would it be recommended for males to take supplements of Viagra or other supplements available to bring erections? That I would recommend that you discuss that with the urologist. The biggest problem we see with erections isn't getting them, it's maintaining them. And that's probably due to decreased sensation in the penis. If you took an able-bodied person and they got an erection and no one touched it, it would go away fairly quickly. It stays up because with foreplay or intercourse, there's stimulation to the penis. But if you have decreased sensation in your penis, it may be harder to keep erections. So for some patients to get good erections, I recommend a constriction band. It needs to be non-latex, but it's sort of like a rubber band that you put at the base of the penis, and it keeps the blood in. That's a fairly simple matter. Medications like Viagra and Cialis are effective in a lot of men with spina bifida, not all, but have good success. But those require a prescription. So I think it's good to talk to a urologist about that, but there definitely are treatments. Is there some place to help her learn to self-cast? She's 16 and developmentally delayed somewhat. you really want to find a program that has nurses that have done a lot of this. And I've certainly worked with some very talented nurses over the years that that have taught some patients to cath that we didn't think were going to be able to. On the other hand, I've seen them in tears too because they couldn't help someone cath. It obviously can be difficult for females because it's harder to see down there. And it depends on the amount of sensation. Some women are dependent on being able to see down there, which why it gets harder when they get older or become pregnant, because they can't see the urethra if they don't have good sensation. If they have good sensation, they can often feel it and feel they're poking in the wrong place. Or patients will tell me I'm poking in the wrong place if I'm trying to cath somebody in the emergency room or something. So I think it's finding a urology program, typically a pediatric urology program, where there are nurses who teach patients to cath, and there should be someone with experience in troubleshooting. With males with spina bifida who show erections when as toddlers to childhood, have there been studies in males having decrease in erection as they grow older? There have not been studies of that. No one has really studied erections in children with spina bifida. As someone who treats able-bodied people, boys, some boys get erections frequently, and other boys don't when they're toddlers and young school-age boys, because the body's not making testosterone. So some boys just don't get many erections. But I know of no studies showing that there's a decrease in erections as they grow older. The fact that you're seeing them now would suggest that things are wired pretty well with the nerves, and hopefully that that should translate into good function in adulthood. And then the last question is just a nice comment saying that they enjoyed it, that a lot of times these sessions at national meetings are addressed to adults and really not enclosed to parents, and that they were happy as a parent to have a chance to learn more about the topic and help them educate their child. And again, that's probably the most important thing I can pass on here, is that that the desires of adolescents with spina bifida are no different than those of children without spina bifida. And with the internet, it's pretty hard for them not to get exposed to things. So I think talk to them as if you would any able-bodied person, and talk about what normal sexual function is like and what the names are and how to protect themselves. Sorry about my dogs. And then determine how spina bifida affects their sexual function, and what precautions they need to take. And again, for females, that they really need to be taught of how to draw boundaries and protect themselves from people who might try to take advantage of disabled young adults. And that's not just true for females, it's true for males as well. Again, particularly people who are being catheterized by nurses at school and things like that. They need to know what an appropriate touch is and what an inappropriate touch is. So any talk with adolescents about sexual function needs to include talk about ways to stay safe.
Great. Well, thank you so much, Dr. Weiner, for your time today and for sticking around a little bit after the hour, and to everyone for sending in your questions. I think that this got us onto a lot of really good discussion topics. Again, we are hoping to be able to do this as sort of a part of a series where we would be gearing some things more toward a session for boys, a session for girls. So if anyone who did sit in with us today has any feedback on how we might best structure that, or if that's something that you would be interested in, please do let us know. Otherwise, we will go ahead and make this recording available online here shortly following this. And thank you so much, Dr. Rayner, for being with us today.
Well, it was my pleasure, and I thought the audience did great. There's not many topics that I felt weren't covered, because the questions were varied, of children of different ages and males and females and different problems. So I think we covered the topic beautifully, and a lot more fun to do it based on audience questions rather than me droning on with a PowerPoint presentation.
Definitely. Well, thank you.
Thank you.
Bye-bye.
Bye.